the country has yet again been plunged into another 4 days of lockdown. For Auckland, it's 8. While many here are compliant and agreeable, there's been heavy criticism from the international press about our elimination strategy. Joining us now is the Prime Minister, Jacinda Ardern. Morena, Prime Minister.
Morena.
Can we start with any updates you might have that you think Kiwis deserve to know tonight? Anything you've learnt between when we last saw you at 4 o'clock to this morning?
Look, nothing to share this morning, Ryan. We leave all of the case updates till the 1 p.m. Locations of interest all go up in between times, but no, nothing to add at this point.
So you're aware of some cases, but they're only announced once.
We do them all at the 1 p.m. because they trickle through over a period of time. So we do them all at the 1 p.m.
Okay.
That's always been the case.
Are there lots at the moment?
Ryan, you can expect an update at 1 p.m. I honestly do not have all of the numbers that have come through for that 1 p.m. update.
Okay, because I know that people get anxious and I know that people get worried about the numbers and they want to know what the numbers are because it's an indication. Can you tell us, on the news last night they mentioned possibly 1,000 cases in the cluster. What's the latest advice you've had on how big this cluster is likely to get?
Yeah, as we've said, modelling, particularly at the beginning of outbreaks, can be quite variable. And so one of the things that we have been sharing at least is that there's been the suggestion that we won't see it peak till between 8 to 10 days, and we're not there yet. So we do expect cases will continue to grow, so people should expect that. The other thing that's different than past experiences, Ryan, is that with Delta, and you saw this in Australia, in the past you might see a few members of a household, if they've got a contact with a family member who has COVID, may also be infected. Now we're seeing that predominantly almost everyone in a household is becoming infected, so that does affect your numbers, and you can expect that's another reason why we'll continue to see those numbers to grow. So really, to everyone, I'd just say, just expect it. It will get worse before it gets better.
Because you will be getting advice on this, of course. You will have modelling shown to you. Is there any reason we can't know what the latest modelling says?
No. I've seen such a range that I'd rather leave Dr. Bloomfield. No, we've shared those ranges early on, and of course, we're close to some of those numbers now. And again, as I said,
50 to
those
120.
numbers are often. If I can finish right, those numbers early on are often so inaccurate, so I don't tend to rely on them too much because they can become outdated even after a day. People remodel them based on, for instance, when we find out that the case started, and some of the modelling I've seen didn't yet have that it was a 7 August start date. So, look, I'll make sure that one of your reporters fires that off to Ashley to give his latest on some of the modelling, but some of the ones I have are old.
No, that's fantastic. Thank you. Do we have any idea, I guess without knowing too much about what's going on at the atrium at the Crowne Plaza, we're hearing this morning that vaccination bookings that were made for the vaccine centre there have been cancelled and some are now having to be rebooked in a few months' time. Has that centre been closed?
Well, what we've done is certainly for our managed isolation facility, the operation that's at the Crowne Plaza, I can't speak to any decisions that are being made on the vaccination centre, but what we have done with the managed isolation facility at the Crowne Plaza, while we do not yet know how the transmission occurred, we are being very cautious, and we're essentially allowing people who are there to complete their time in quarantine, and then we are not refilling it. And that's because we want to get to the bottom of what's happened. All the decisions around the vaccination centre and what happens there are all taken by public health.
But you're not aware of it closing at this point, the vaccine centre?
Nor would I necessarily get an update on that.
No, that's right.
So
that's
something that public health decide.
We just had one of our listeners email in this morning with their story about that, so we can check it with public health.
Sure.
In terms of the vaccine, we know that the vaccine saves lives, Prime Minister, and it was Jenna Lynch on Newshub last night who revealed that there were just 3 of those 107 cases, 3 of them have been fully vaccinated, which is 2.8%. How would you describe that rate of vaccination in a population when we knew Delta was going to come, when we've been living with the pandemic now for 18 months? How would you describe that rate of vaccination, Prime Minister?
The two things I'd say, Ryan. The number that I shared yesterday at that time was actually 11, but some may have had first doses, some may have had second. And that's not surprising because, of course, you'll know we're moving through the age cohorts because those who are most at risk are our older New Zealanders. And this is an outbreak that is affecting younger New Zealanders in particular. You'll see those locations of interest, halls of residence, university, and so on. So that's not unsurprising given where we are in our rollout, that it's a number more like 11 than a higher number because of that rollout cohorting.
Should we be further along in the rollout?
Is that we've always, happy to answer that question. We are exactly where we anticipated being right now from the beginning of our vaccination campaign because we always said that it would take us a year and that the second half of the year is when we hit our full-scale rollout. And you'll see that now. We're hitting record days.
How did these other countries do it so much faster?
Over 50,000. And yet, if you look at some of those other countries, they've also stalled, some sitting at 60%, and that is not enough to stop outbreaks.
The
so
UK's
those countries for whom you are comparing, if I could actually, the UK is not at 87, they're more like 70%.
The BBC says over 16-year-olds at 87% for both vaccines. That's the BBC this morning.
Of course, eligible. If you look across those populations, and that's, of course, we were interested in looking at where that starts having an effect on cases. So, look, the reason that we want to see everyone vaccinated is to keep them protected. And so for all of those countries for whom you'd say that they've had somehow more success, I would say, what is your measure of success? We have kept New Zealanders safe, and we will continue to do so while we have our full-scale ramp-up of our vaccination campaign. But my ambition is far beyond the United States and the UK's rollout. We need to have as many New Zealanders as possible vaccinated if we want to protect them against the kinds of outbreaks that you are still seeing in both those countries for whom you would compare us to.
And that's where we get into this numbers game about Scott Morrison, the Australian Prime Minister, saying, well, once we get to 70%, we won't need lockdowns. Once we get to 80%, we can open the borders. What's our number? Do we have a number?
I want to go as high as possible. You'll see that we've had our experts say to us that, look, if you just rely on a number, and I actually really hear them on that. We've pushed them hard because it's much easier to communicate to people when you're in a situation where you want as many people as possible to turn out and be vaccinated. It's much easier to say, here's our goal. But I think rightly so, those experts have said to us, well, actually, you don't ever want to create a situation where people hear a number and say, oh, well, if I'm a part of the group that don't show up, then that's fine. It's not fine. And the other reason is because actually, even if you have a high number, what it won't tell you is whether you've reached enough young people, whether you've reached enough vulnerable people. You can see in this particular outbreak, for instance, if you had a really good solid number, say you have 80% of New Zealand vaccinated, but you only have 60% of your, say, 18 to 24-year-olds, you could still have a significant outbreak amongst that group in those locations that are really high risk. Our goal has to be, I agree with Mark on this. He said, I think earlier in the week, he said our goal should be to be the top of the table. Let's do that.
We all agree on that.
Let's seek to be the best in the world.
On that point, will you order more vaccines? Have you picked up the phone like Scott Morrison has to Poland? He's got a delivery of 1 million landing this week. They're having mass events in Sydney at the moment as well.
We don't need more vaccine because the difference between us and Australia made the decision that they wanted to be a manufacturer for AstraZeneca. So they didn't have a single vaccine portfolio, a single vaccine that covered their entire population. So that's why they're in that position. And, no one would wish anyone to be in a difficult position where they are having to seek additional because of restrictions on AstraZeneca. We have more than enough for our whole population for Pfizer.
Which has been ordered.
We are not in the position of needing to do that.
But yes, I guess what I'm saying is,
since the beginning.
Let's say that we get through this outbreak and, God willing, in a couple of weeks we're able to come out of lockdown, whatever. What is to stop Delta coming back in and attacking a still vulnerable population who haven't been vaccinated? I think people are wondering, can't we ramp it up to protect us from the next possible outbreak?
And we are ramping up. You know, the fact that even in this week where we've had, of course, record amounts of testing, we've had record vaccinations as well. A record day yesterday in the Auckland region as well. I've seen reported we've got one site that had almost 2,000 people going through it. And you asked about vulnerable people. They were actually the first groups that we prioritised. So we prioritised those who might interact with COVID, our border workers, our healthcare workers, and then the next tranche were our older people and those with underlying health conditions. So if you are in that group and you have not been vaccinated yet, you are our priority grouping. Please make sure you go out and get vaccinated. You've been at the top of our list since the very beginning.
Prime Minister, it's a strange day when you agree with Mark Richardson, but I've seen stranger things happen. Thank you very much for your time.
And I'm not just saying that because he's not here to defend himself.
He'll be here after 8 o'clock. We'll see what he's got to say. The Prime Minister of Aotearoa New Zealand, Jacinda Ardern, thank you very much for your time this morning, as always.